there's many diseases and many pathogens who actually come from wildlife. Up to 70% of pathogens that come spread through humans are originating in wild animals or in animals in general. The consumption of wildlife in these forests has tremendous implications, and we don't know enough about to what extent it can affect human health in the long term. I am currently in Colombia because I'm finishing a Vetenskapsrådet-funded project on hunting and forest governance in the Amazon region. So I've been working the last couple of years with indigenous communities in the Amazon region on traditional hunting, traditional ecological knowledge, and the implications this might have for more sustainable forest governance in the future. As it seems right now, the coronavirus that has spread around the world has actually come from bats. People have hunted bats and sold bats on wildlife markets, and someone has consumed them. People still consume wildlife in Africa and parts of Asia and in South America because they need to consume these animals for personal well-being, for nutrition, but also because they need to sell those animals in order to make a living and to have access to cash. Right now in the Amazon region in Colombia, what we can see is that people are suffering, particularly indigenous communities are suffering really severe consequences from this pandemic because they have very little access to healthcare. Self-isolation is very difficult in these communities, but also because of the market economy. These communities have been told for many years that they should interact and engage with the market economy. Instead of remaining more subsistence, they should sell certain products. But now we can see with the stop of access to cash, there's no tourists in the southern parts of Colombia who go to Leticia to enjoy the Amazon region. So indigenous communities can't have access to cash anymore, so they can't buy what they need, what they are consuming for their families, food and so on. So they're relying much more, again, on subsistence, which is agriculture, but it's also fishing and hunting. We have to actually work much more with more sustainable ways of hunting and more sustainable ways of consuming those animals, which are an important resource for local communities. So I think as a scientist, as a researcher, it's pretty unethical right now to go to communities and talk about anything else that is not related to the current health crisis. And communities are really suffering because they lost their livelihoods, they lost their incomes, and they have actually really severe consequences for people's health, of course. Even if I could travel, I wouldn't want to take the risk to travel to indigenous communities who are pretty much isolated or very far away from urban areas and bringing the virus to them. So of course there's my own personal responsibility that I think we should not travel to these places right now. What we can learn from this in the long run is that we need to talk about how communities and how people around the world actually interact with wildlife, with wild animals, how we consume them, and how the illegal and legal wildlife trade actually poses a risk for future pandemics.